So my name's Liz Young. I'm an occupational therapist, and I just recently got my OTD. I work as a school-based therapist. So in addition to doing all that good, like fine motor, visual motor stuff, I do spend a lot of time making sure that my students feel regulated and safe to be able to participate across school settings. So I've been doing that through supporting like sensory regulation and giving brain breaks and also using the interoception curriculum. And I've been using it for several years and was a little bit maybe discouraged by lack of carryover and lack of kind of buy-in from teachers, especially, but also just being able to communicate at home and carry that over at home. So when it was time for me to do my capstone project, I kind of just thought like, okay, what do I wish I could sit down and talk to the other adults in these kids' lives about? Like, explain why I'm doing what I'm doing, how it works, what the purpose is, to kind of try and get that buy-in and help them understand that. Because I think when we're coming from more of a what's the word I'm looking for? Like a compliance-based approach, that some of these things seem maybe like we're not holding kids accountable or we're not giving them high enough expectations. But I wanted to be able to explain like why this works scientifically and how it can be helpful. So that ended up looking like I created a webinar for my community and started with some of the background information, like what is self-regulation, all the skills that are involved for it, what is sensory processing, what does it look like, how does it look when breakdowns happen, and then just what is interoception. A lot of the participants had not heard of the term at all before. So just explaining what it is, how it tells us about our body sensations and our emotional states and how those things can interact with each other as well. And then from there, I just talked about some really basic kind of broad strategies. We talked about body scans and body-based mindfulness. We actually used one of the IA cards as a practice in the group, like just squeezing your hands together and releasing to practice just tuning into that and thinking about the words you can use to describe things. And then I spent also a lot of time on co-regulation because that's something I do very frequently at school. So kind of describing what it is, how to do it, and how that we as adults have to be regulated in order to help regulate a child. So thinking about what we as adults need to stay regulated in those situations and what tools can we use and how can we be modeling some of the strategies that we want kids to use, because that's one of the best ways for kids to learn is seeing adults do it efficiently. So that was about an hour-long webinar. We had participants fill out a pre-intervention measure when they originally signed up, and then a post-intervention measure about 2 weeks after, so that there was some time to apply the skills learned. So I split up educators and caregivers. The educators at the post-intervention test showed significant improvements in 4 out of the 6 areas of interoceptive awareness that we measured. They showed a significant decrease in perceived stress over the last 2 weeks and a trend toward feeling increased feelings of closeness with their students. And then the caregivers showed significant improvements in all 6 areas of interoceptive awareness that we measured. They showed a trend toward decreased stress. It wasn't statistically significant, but a significant improvement in feelings of closeness with their children, which was amazing. We got a lot of really good qualitative feedback as well. People mentioned some of the things that kind of stuck with them, being deep breathing and the purpose behind it, tuning into sensory signals and listening to our bodies. And I got a lot of feedback that really helped people, especially educators, kind of see from a new lens what behaviors might be, really driven by. It's a need to feel comfortable and safe rather than to avoid work. So that was really exciting. We have gotten a lot of like requests for additional work with it, just either recording the webinar to send out to people, or I'm actually offering it as a professional development in my school district next year. So it was really exciting to see how after just an hour, like it did take a little while to, create the presentation and set it up. But from then on, it was really just an hour of my time, like 50 minutes of the presentation and then some Q&A, and no real connection after that. Just like given that time to instruct on what these concepts are and how to use them. And then checking in 2 weeks later, there was a significant improvement. It was really exciting. And it shows that I think this could be a really good way for school-based therapists who might not have a lot of time or as much time as we would like to connect with other adults in the child's life, to like, introduce this information and give it in a supportive way that helps people understand the why behind what we're doing. Because then I think you just get so much more buy-in and so much more understanding of how we can support kids across settings.
Mm.
That's my
Amazing.
her little spiel.
That was perfect.
Oh,
Thank you
thank you.
so much, Liz. Yeah, I think that I had asked you, and if you don't mind sharing, like what
Yeah.
do you think was the biggest surprise for you in this whole process?
Definitely how effective it was at improving interoceptive awareness because I wasn't sure if that was enough time to really see those changes. But I think it was so interesting that really just having a basic understanding of what interoception is and why it's important, I think really helped people tune in and kind of think about it a little more in their day to day life.
Do you think that that was a factor in the reduced stress that you found among educators and
I
caregivers?
think so. And it was interesting that I think educators had a little bit more reduced stress. I'm thinking probably because they have more control of their environment, at school. So it's a little bit more concrete. Whereas in home factors, there's a lot of other things that go into it. Um, so I think that that reduced stress is probably helping things like in the moment in those smaller instances of stress and dysregulation, but maybe not as helpful for those like overarching life stressors.
Yeah, absolutely. I 100% agree that home environment, speaking as a parent, is very,
Yeah, there's a lot going into it.
yeah. And then my last question is about the closeness factor that you
Yeah.
measured. What are your takeaways there?
Yeah.
What's happening, do you
So
think?
I used it was two separate measures for the educators and the parents. There was the child-parent relationship scale for the parents and a student-teacher relationship scale for educators. And they both have had subsets that were like closeness factors. So they were rating things like my child feels comfortable coming and talking to me about things, or my child openly shares with me, or I feel like I understand what my child needs. So it was really cool to see such a significant increase in that, just having the background information about these are other things that my child could need in these moments. Maybe it's not just behavior, it's not just XYZ, but there's these other factors that are playing into it that just gives people kind of a better understanding of their child as a whole, and how they can support them and understand them.
Wow, that's just
It was
incredible.
really
I mean,
exciting.
I mean, I think those are all the things that we want, as a parent or as a
Yeah,
therapist or an educator, is that people that our kids feel safe enough to come
right.
and share their insights with us and that we'll believe them.
Yeah,
Yeah, amazing. Well, thank you so
great.
much. Is there anything else
Welcome.
you wanna to end with?
No, I just think, I mean, honestly, after making the presentation, it was a really easy, simple way. And then like now that I have it, I'm going to keep using it and keep introducing it in different ways that you can scale, like at larger meetings or even one-to-one with parents. So I'm really excited that I have this now to continue using.
Yeah, absolutely. All right. Well, thank you so much.
Thank you so much.